Hello everyone, this is Dr. Prashanth and welcome back to Public Health series. In this video, I'll be talking about the PNDT Act along with the MTP Act. PNDT is an act to provide for the prohibition of sex selection before or after conception and for regulation of prenatal diagnostic techniques. It was amended in 2003 to PC-PNDT Act to improve the regulation of technology used in sex selection. The main objective was to ban the use of sex selection techniques before or after conception and prevent the misuse of prenatal diagnostic techniques for sex selective abortion. The basic requirements of the Act are registration under Section 18 of the PC-PNDT Act, written consent of the pregnant woman, and prohibition of communicating the sex of fetus under Section 5 of the Act. Maintenance of records as provided under Section 29 of the Act. Creating awareness among the public at large by placing the Board of Prohibition on sex determination. The main provisions in the Act are, as I already said, it provides for the prohibition of sex selection before or after conception. It regulates the use of prenatal diagnostic techniques like ultrasound and amniocentesis by allowing them their use only to detect the genetic and chromosomal abnormalities, metabolic disorders, certain congenital malformations, hemoglobinopathies, and sex-linked disorders. No laboratory or center or clinic will conduct any test including ultrasonography for the purpose of determining the sex of the fetus. No person should communicate the sex of the fetus to the pregnant woman or her relatives by words, signs, or any other method. Any form of advertisement for prenatal and preconception sex determination facility will lead to the imprisonment for up to 3 years and fine of around rupees 10,000. And now coming to the MTP Act, Medical Termination of Pregnancy Act 1971. It is an act to provide for the termination of certain pregnancies by registered medical practitioners. Before that, we look at the three-tier classification of abortion. We call it a safe abortion when it is provided by healthcare workers and with methods recommended by the WHO. Less safe abortion when it is done by trained providers using non-recommended methods or using a safe method but without adequate information or support from a trained individual. Least safe abortion when it is done by a trained provider using dangerous invasive methods. Now coming to the key features of MTP Act 1971, it has legalized abortion by a registered medical practitioner up to 20 weeks of gestation period. So until 12 weeks, we need opinion of one doctor for the termination of pregnancy. Between 12 to 20 weeks of gestation, we need opinion of two doctors. For gestational limits of 20 weeks and 24 weeks, the right to seek abortion is determined by the registered medical practitioner on the following grounds. If continuation of the pregnancy poses a risk to the life of the pregnant woman or of grave injury to her physical or mental health. Substantial risk of serious fetal anomaly. Pregnancy up to 20 weeks due to failure of contraception and pregnancy up to 24 weeks because of rape, both considered a grave injury to mental health of a woman. So, the MTP Act was amended in 2002 and it provides for the following. Substituting the word lunatic by the words mentally ill person. And it has given powers to the government that include the district level committee headed by the chief medical officer or district health officer to approve places for medical termination of pregnancy. And serious punishment, which includes imprisonment of not less than 2 years and extending up to 7 years to those clinics which are not authorized to conduct abortions and to those persons who are not registered medical practitioners with required experience or training for terminating pregnancy. Even after the implementation of MTP Act, 56% of abortions in India are under the category of unsafe. In 2015, around 11.5 million abortions were medical abortions done outside the medical facilities, which are very unsafe. So, considering this huge burden of unsafe abortions, MTP Amendment Bill in 2021 was passed. Coming to the key features of MTP Act 2021, as we already know, initially it was till 20 weeks of gestation period, right? So they have enhanced the upper gestation limit from 20 to 24 weeks for vulnerable groups of women, which include minors, differently abled women, etc. So up to 20 weeks of gestation, we need only opinion of one registered medical practitioner. And between 20 to 24 weeks of gestation, we need opinion of two registered medical practitioners. And the non-applicability of the provision relating to the length of pregnancy in cases where the termination of pregnancy is necessitated by the diagnosis of any of the substantial abnormalities diagnosed by a medical board, and strengthening protection of privacy of a woman whose pregnancy has been terminated. The failure of contraceptive clause extended to women and her partner. So this table shows the difference between the gestational limits and the opinion of doctors in both MTP Act 1971 and MTP Amendment Act 2021. So as already said, in the MTP Act 1971, the termination of pregnancy is till 20 weeks, right? So we need advice of one doctor in case of until 12 weeks, and we need advice of two doctors from 12 to 20 weeks. Whereas in MTP Amendment Act 2021, we need advice of only one doctor till 20 weeks of gestation. And we need advice of two doctors of same category if the gestation limit is 20 to 24 weeks. In case of after 24 weeks of gestation, we need approval of medical board and only if there is a substantial fetal abnormality in case of MTP Amendment Act 2021. Whereas in case of MTP Act 1971, we don't have the provision to do the termination of pregnancy until and unless if there is a serious need to save the life of a pregnant woman. And now coming to the timeline, we know that MTP Act was started in 1971, followed by PNDT in 1994, which got amended in 2002 to PC-PNDT, Preconception Prenatal Diagnostic Technique Act. The MTP amendment was also done in 2002, where the term lunatics was replaced by mentally ill persons and the power was given to the government to select the place for the termination of pregnancy. And MTP Amendment Act 2021, where it has increased or enhanced the gestational limits from 20 weeks to 24 weeks. Thank you.